Hi Jeanette, my name is Sam. I'm going to be your student physical therapist
Hi.
today. Is it okay if I call you Jan?
Yeah, that's perfect.
All right. Can you tell me a little bit more about why you're coming in to see me today?
Yeah, so I was dancing a few weeks ago because I'm a dancer, and also my back just started hurting during the session, so I don't
Okay.
really know.
Okay. And when did this happen?
3 weeks ago.
3 weeks ago. Okay. And can you describe for me the pain that you experienced when you were dancing? What did that feel like?
It just really felt like a strong ache in my back.
Okay. Strong ache. And would you say that that ache was like a deep ache, kind of all over, more on the outside?
It's kind of a deep ache, but all over.
Okay. And can you point to me, or point out for me where it is in your low back?
Yeah, so I'll turn around here. So it's kind of just like all in here.
Okay. So more spread out over your entire lower back.
Mhm.
Okay. And there was no sharp moments of sharp pain, it was just a deep ache from the beginning. Does
Yeah.
that sound right? Okay.
Yeah, there's moments that feel stronger than others, but it's still an ache.
Okay. And then does the pain travel anywhere or does it stay pretty local?
I sometimes get pain in my butt too.
Okay. And which side?
The left
The
side.
left side. Okay. And when the pain came on a scale of 1 to 10, 1 being little to no pain, 10 being needing to go to the ER, where was that pain when it initially started?
I'd say an 8.
In 8, okay.
Yeah, it hurt.
And did you continue with activity afterwards, or did you stop?
I continued for a few more minutes, but I just stopped after that. I
Okay.
haven't danced since, which has been a big change for me because I dance every day, and I've been dancing since I've been 3 years old, so
Yeah.
it's just not normal for me, but
Yeah, that's hard. I'm sorry to hear that.
Yeah.
And then, at its best, what would you say the pain was, using that same scale?
at the best, a 2.
A 2, okay. And 8 for the worst. And how about now, just sitting here at rest, how does your low back feel on the same scale?
A 4.
A 4, okay. And how about when the symptoms come on, how long does it typically last, or what does it look like when the symptoms come on? How long does those symptoms stay around? Does it take a long time? Does it go away pretty fast?
When I do some activities, like certain movements, it gets stronger for a few minutes, but then it goes back to the kind of regular ache.
And are there any specific movements? I know you said you were dancing when it happened. Are there specific movements when you were dancing or even outside of dancing that make your symptoms worse?
Yeah, so when I'm just kind of around my house or at work, just like bending over, standing up, walking around, those activities irritate it. But then also dancing hurts too. So when I'm doing the splits and jumping and kicking and everything, it just bothers me too.
Okay. And are there any things that you've done over the past 3 weeks that has made the pain better?
Laying down helps, and also I use heat and take some ibuprofen occasionally.
Okay. And since you hurt your low back, or even beforehand, have you ever had any treatment for lower backs from a medical doctor?
A few years ago I had some back pain too,
Okay.
but it didn't last long, and I went to a chiropractor and it was fine.
Okay, did the chiropractor seem to help?
Maybe, but it didn't last long, so it could have.
Okay. And then how about, what do you do for work? I know you like to dance. Is that what you do for your job, or do you have other activities and duties outside of that?
Yeah, I'm actually a school teacher, so I teach kindergarten. And those little kids are always running around, and I'm always having to pick up after them. and there's always just everything around the room. So every time I have to
Yeah.
bend over to pick something up,
That's
it just
frustrating.
really bothers my back.
Yeah, I'd love to hear more about the teaching, maybe after when we're working on some exercises, but just to
Okay.
respect your time and mine, I'd like to get back to the evaluation.
Okay.
Is there anything that you're doing as a school teacher that you aren't able to do now because of your low back pain?
I still do everything. It just hurts. Yeah.
Okay. And is there anything around the home that you do that they used to do before the back pain that you can't do now?
I still do everything around the home. I can still vacuum and do laundry and do my dishes and cook and stuff, but yeah, it just bothers me. I have to kind of take a few rest breaks throughout.
And those rest breaks seem to help decrease your pain.
Yeah, I just sit down for a little bit
Okay.
or lay down sometimes.
All right. And you said you're just taking ibuprofen. Are there any other medications that you're currently taking for any other conditions as
No.
well? Okay. And are you taking the ibuprofen just as needed?
Yeah.
Okay. And then do you have any other history of any other conditions, surgeries to deal with your head, heart, lungs, any other parts of your body that you can think of?
No.
Okay.
Generally pretty healthy. Didn't have a lot of issues, I guess.
Okay, that's good to hear. And then in terms of activities that you were able to do before your low back pain that you aren't able to do now, do you have any other goals that you'd like to get back to? I know it's
I'd love to get back to dancing.
dancing.
Yeah.
Okay.
As long as I can get this pain away and I can get back to dancing and then just doing my everyday activities without pain.
Okay, and everyday activities. Okay, awesome. And then I just have a few other questions to ask, just to generally screen for any other conditions that might be going on. Since you had the low back pain, have you had any nausea or vomiting? No. Any fever that you've noticed?
No.
Okay. Have you felt just generally unwell since your low back pain?
No, I feel fine.
Okay. And any confusion or dizziness?
Nope, I
Okay.
feel fine.
Okay. And then I know it can be hard to lose something that you find enjoyment in. Have you noticed any increased sadness since the accident? No, nothing like
No, I mean, I'm sad that I can't dance right now, but otherwise I'm fine.
that? Okay. Not finding little pleasure in doing things over the past month or anything like that?
No.
Okay. And then sometimes the low back pain can be related to other things that are going on around the hip and pelvis. Have you noticed any changes in your bladder or bowel habits at all?
No, but yesterday I peed my pants for some reason, and it usually doesn't happen, and I didn't try to do that, so it's kind of weird, but
Okay.
I don't know.
Is that the red flag?
Yes.
Okay, good. Okay, so just as a summary from everything that I have gathered from you so far, it sounds like 3 weeks ago you were dancing and had a little bit of low back pain come on. Seemed like it was a deep ache, was about an 8 out of 10 at worst, has gotten better over the last 3 weeks. It's now at a 4 out of 10, just sitting here. Sounds like it has gotten down to the glute sometimes, the left butt cheek. Laying down in heat, along with ibuprofen, seems to be knocking down the pain a little bit. You saw a chiropractor previously, didn't really help, and you have otherwise a healthy history. You'd like to get back to dancing and doing activities without pain. Is there anything else that I've missed? Anything you'd like to clarify that you would like me to know?
Nope, that's
Okay.
it.
Awesome. Well, I'd like to get into the objective examination now, so good.